What I was seeing was just sort of tearing at me at that time. The doctors, the nurses, the activity in the ICUs, the wailing of the ambulances. It was otherworldly.
Gut-wrenching even for a retired nurse like 81-year-old Rose Strickland with 42 years experience.
I know what they're feeling. I know the stress. I have pruned patients.
So she did what she knew she could, enrolled in Moderna's COVID-19 vaccine trial, and encouraged all 3 of her children to participate in COVID vaccine trials too.
I felt the need to do something other than watch the news and shelter in.
As a woman of color and a senior, 2 groups disproportionately burdened by the pandemic, Strickland also recognizes the significance of her participation.
I have to be in it if I want some assurance that when a vaccine is developed, it will be as valuable for me and people who look like me as it will be for anyone else. If we don't have our gene pool in there, how are we going to know whether it works for us?
But so far, Strickland and her children acknowledge they may be the anomaly within their circles.
When I speak to my friends, people I know, my neighbors, most of whom are well informed, they're not biting at the bit. One of my closest friends says, I'm going to wait.
Why do you think that is?
She said, I'm going to wait to see if you grow a tail.
I mean, we don't know.
Yeah, I'm finding
absolutely.
reluctance as well here on Miami Beach.
Experts say the mistrust can be seen in the lack of diversity among vaccine trial participants. So far, efforts to diversify the national COVID-19 trial registry have fallen short of the goal for it to reflect the distribution of disease burden within the population. According to the NIH Registry for COVID Trials, less than 12% of participants are Black or Latino, while the CDC says of cases where race was recorded, more than 37% are Black and Latino. Strickland points to the past.
Is there any wonder that they might not be the first people willing to, their way of thinking, be used as the guinea pigs?
The abuse of Black slaves in medicine, where they were used as subjects of experiments, is well documented. The scars run deep, even as effigies of scientists once celebrated for their medical breakthroughs are ripped down in recognition of the crimes committed in the name of research.
It is not just the legacy of the way Blacks have been treated. It is the current day experiences of discrimination in the healthcare system that reinforce that mistrust.
As public health and political leaders struggle to find ways to convince Black Americans and other affected groups prioritized in distribution plans that the vaccine is safe, there's concern that others who shouldn't gain early access to the vaccine will fill the void.
One of the things I worry most is that people who need the vaccine the most aren't going to get to be the people who get access to it.
In order to build necessary trust within Black and Brown communities, experts like Richardson are calling for an unprecedented level of transparency, like allowing independent, locally respected experts to fully vet vaccine data. The Strickland family, too, says candid, clear communication of what people can expect from the vaccine would also help. As for Rose Strickland, she will continue to do what she sees as her part, remaining in the Moderna study for 2 years.
I think it's an honor to be a participant in a study for a vaccine to control a disease that is just devastating.
And she says she hopes lessons were learned, that building trust in the healthcare system and in vaccines requires institutional change long before a crisis strikes.
Until
You have people who look like us at the CDC, out front scientists, healthcare executives, at the national, local, state level. You can't wait until we're in the midst of a pandemic